disclosure, I have been utilizing the Pulse Nd:YAG laser, thank you, for the last 10 years. And it's truly been a game changer in my practice as a periodontist and saving team. And it's my first time lecturing at the AAP, so please be kind to me. So Dr. Romanos did a beautiful job, and truly, not all lasers can treat all tissues and can't treat them equally well. And that's because of what Dr. Romanos very clearly designed, is that it's about the absorption of that laser into the tissues. Each tissue absorbs each laser differently, and nothing happens until that absorption takes place. So Dr. Romanos again did a beautiful job at looking at those different penetration depths of each of the different lasers. And what you'll look and see, is that the Pulse Nd:YAG, as Dr. Romanos clearly stated, does penetrate fairly deep into the tissues. And that's important for the Nd:YAG and for the treatment of laser therapy for periodontal disease. So what does this mean clinically? Well, first and foremost, the Nd:YAG laser is transparent to the cell wall membrane, and it passes through those tissues that are healthy. It also is highly absorbed in dark pigment, and this is incredibly important because of those gram-negative anaerobic bacteria that lie deep into those pockets, and that's what we're targeting. We want to make sure that we annihilate them, and that's what this laser does beautifully. It also is well absorbed in hemoglobin. Obviously, we're treating diseased patients. There's a lot of blood, and we want that laser to pass through all of that hemoglobin in order to get to those targeted tissues. And as well, it's not well absorbed in the connective tissue, and that's important because we don't want to destroy all the tissue that's supporting our teeth. So here is a clinical picture of what the Pulse Nd:YAG laser, the Millennium. It has a quartz fiber optic fiber, and it's in a bendable cannula. And this is really important because goodness knows when you're trying to get that laser around the distals of second molars or in lingually tilted lower incisors, it's very, very difficult. And so to be able to have that bendable cannula is important because it allows me to get where I need to go. And here is the fiber penetrating down into the periodontal pocket, again, removing the diseased epithelium, but leaving the external tissue intact. This next slide is the most awesome, and I wish I had this earlier, I would show it to my patients. And basically it's going to show you the use of the Nd:YAG laser in a black balloon surrounded inside a clear balloon. And you'll see the clear balloon stays intact and the black balloon gets annihilated, and hopefully this will work. And thank you, Dr. Hahnemann. So the laser energy is going, it's going through the clear balloon, and the black balloon is annihilated. That's exactly what happens as well with our black pigment bacteria. So what is the protocol for LANAP? It's very, very strict. The one thing I will totally agree, and Paul and I and anybody else, can I actually have a raise of hands for those who are LANAP clinicians in the audience? Awesome, that's really fantastic. And we all certainly know the benefits of what this does. So here is the initial evaluation, the probing to depth of what our pockets are. Here is the first stage of the laser treatment. This is called the ablation stage. This is where that quartz fiber is penetrated down into the pocket. It goes in 1 millimeter increments, 360 degrees circumferentially around the tooth. Certainly annihilate all those bacteria as the negative gram-negative anaerobes, as well as maintaining the healthy bacteria present, but more importantly, removing the disease epithelium. This is probably the most important stage of LANAP therapy, and that is the root preparation. We use 3 different types of piezo tips, and it's significant root preparation and removal of the calculus. The one thing I will say is that the Nd:YAG laser does cause the really tenacious calculus to become much easier to remove. So instrumentation is not as tenuous as it is when you're just doing traditional scaling root cleaning. And then coming back with the second piezo, or the third piezo tip, and that is basically where we're actually decorticating right down to the crest of bone, starting that initial release of those stem cells and those growth factors, so important in that initial wound healing process. And then the next pass of the laser is the hemostasis phase, and this is where it's, again, the fiber tip goes down into the pockets and basically stimulates all of those reedy ridges to allow the release of fibrin, stem cells, the growth factors. And this is where that initial clot formation takes place. And then as well, here's the clot formation. Occlusal adjustment is absolutely imperative when we're doing LANAP cases because we know that those occlusal forces play a role on the stability of that tooth. And so every LANAP case, for the most part, needs and gets occlusal adjustment. And then this is where we're showing the regeneration of the bone and the reattachment of the tissue. The one part that is not on this particular slide is at the very end of the treatment of LANAP, we do a procedure called biostimulation. It's a different setting of the laser, but it allows you to get that laser energy to penetrate into those tissues and really initiates that wound healing. It's the same as low light level therapy, and it's used very commonly in medicine as well. So here's a case of Dr. Honigman's. Again, thank you, Alan, for the donation of so many of your slides and cases. When Paul asked me to come up with these anterior cases, looking back at mine, I didn't have that many, I have a few, but thanks to Dr. Honigman for his contribution to this. So here's an individual, 40 years old. Again, it doesn't take one to see that there's significant advanced periodontology. It had been 20 years since he had been to the dentist, and there's significant loss of tissue attachment, as well as you can see on his periapical films, the advanced bone loss here in the anteriors, as well as here in the lower anteriors. He did lose a molar or two due to the advanced nature of his disease, but this is an anterior seminar, so this is what we'll be focusing on. Here he is. This is right after the hemostasis phase. You can see all of the blood clots. This is so important, and I tell all my patients, leave them alone. They want to kind of pick them off or rinse them off, but that is what creates the seal around these tissues and allows that inner biologic healing to take place. Here is the next slide of him 1 month later. And again, his anterior teeth needed to be splinted. You can certainly imagine the mobility that was present. But again, look at these tissues. They are absolutely pink and beautiful, and he's doing, again, another important parameter is optimal oral hygiene. Here is the patient now 9 months post-LANAP. And again, here he is, just taken earlier last month. He is over 5.5 years, and he has his teeth. He's super happy that he gets to keep them. His tissues are beautiful, and he has come in every 3 months religiously for his periodontal maintenance therapy. Again, another very, very important parameter for the sustenance of this. Here are the probings. Again, this was originally probably 8 or 9 millimeters, now probably down to 3. And you can see the blanching of the tissues, and this is 2 or 3 millimeters as well. So beautiful health, perfect stability, and he gets to keep his teeth. And that's what we periodontists need to continue to strive and focus on. And here are the follow-up radiographs at 5 years, again showing a dense lamina dura present, general stable bone levels. There is still splinting, and that's important because we want to make sure that we control those occlusal forces. So the splinting is palatally or lingually on these teeth. Here's another case, a 79-year-old woman with very, very deep probings, 12 millimeters on the mesial of number 8. And again, you can see the advanced vertical defect present here. And again, 12.75 months post laser-assisted periodontal therapy as well. Look at that bone fill. We know that that is a stable tooth, and this woman gets to keep it and does not need interventional therapy for dental implants, or for that matter, even a bridge. Another individual, 15 millimeter pocket on the mesial of number 10. Again, a pretty significant osseous defect between number 9 and 10. Many people would think this is not be a treatable situation, but laser-assisted therapy was in fact performed, and here we are down to a 2 millimeter pocket and just absolutely beautiful bone fill. I mean, it's very difficult to think that we get that doing typical regenerative therapy with biologics, but with laser, this is what we very traditionally see. Here's one of my particular cases, a 51-year-old woman who came in, referred to me with a 5 to 6 millimeter pocket on the mesial number 8. Restorative dentist was concerned. She was interested in veneers, but he wasn't going to treat it until he got the disease under control. And here she is now, a year later, and again, you can see that there's been bone fill and regeneration. Another case of mine, very similar to Dr. Honigman's, very, very deep pockets, 6 to 8 millimeter pockets between 9 and number 10. And again, just 6 6 months. Although the bone fill hasn't been quite down to where we might want it, but it's stable, 2 and 3 millimeter probing test. Here's another individual, again, Dr. Honigman's laser-assisted periodontal therapy was performed on 89, and again, this is 3 months later, you can start to see and appreciate that there's regeneration starting to take place. Now, here are some CBCT images that Dr. Honigman took on many of his patients, and this is what's so impressive, is you can see that mold-like defect present around this particular patient. Laser-assisted therapy was performed, and here we are. You can see that mold-like defect completely filled in. This is so non-aggressive. It's one of the most conservative ways that we can help to treat our patients and to help to minimize significant potential loss of tissue. This isn't advancing. This is not advancing.
Go ahead.
Oh, there we go. Thanks, Paul. Okay, thank you. All right, and again, the blue arrow is just showing the bone fill around the extensive defect that we had around this particular case. And this is, again, difficult to see, but we had probings of 6 to 8 millimeters in the anterior, and I apologize for not magnifying that. But again, here it is 1 year later, and probings of 2 and 3 millimeters. And the patient gets to keep their teeth. And again, we can appreciate the increase in bone density and the bone fill between these 2 teeth. And another CBCT image of, again, a patient 9 to 12 millimeter pockets on a mold-like defect around tooth number 9. And here the patient is, almost 13 months later. Again, no bone grafting, no membranes, no flat osseous, no sutures. This is phenomenal. I mean, this is what we want to provide to our patients. And again, just demonstrating the increase in bone fill around this mold-like defect. And the probings from 12 to 2s and 3s. That is success. And here's a very cool 3D kind of printed model of where the defect was originally. And you can see that extensive bone loss around the impalpable aspect of number 9. And again, here is the 3D image post-laser therapy and the increase in bone fill and regeneration and the fact that the patient gets to keep their tooth. So, we know laser therapy. Paul did a great job, George, Paul and Mark, about this workshop that took place 4 or 5 years ago, that truly laser-assisted regeneration is an approach to treating for regeneration that is minimally invasive. And that it also is very important to use a minimally invasive approach in the aesthetic zone, which is exactly what this particular session is all about. And it's very, very important that we acknowledge that there's very little recession and very little result of a more traditional approach. And as well, especially in the LANAP patients, it's fabulous for multiple defects as the first line of management. You can always come back, and I will tell you, in full disclosure, there are times that I had to come back and do a more traditional approach, but that's probably like 5 years out from when I did my initial laser therapy. Regeneration, we know it means new cementum, ligament, and new bone. And we know that we can find this in the LANAP protocol as well. Dr. Romanos did a great job showcasing this particular research by Mark Nevins that came out 5 years ago. And again, in a blown up, magnified view of the histology, again, new cementum, where there was old on a previously diseased root surface and new bone. So the laser effects with the biostimulation that we talked about, again, it's proposed that it does accelerate the wound healing by establishing a natural barrier at the junctional epithelial margin, and most importantly, it really helps to minimize their discomfort. So, the advantages of LANAP. It goes without saying there's very little to no recession. We don't see that traditional shrinkage that we do with many times traditional surgical therapy. Little to no postoperative discomfort. My patients, I don't even give narcotics to my patients who I do laser therapy on. They get antibiotics and they get Tylenol and Motrin, and that's it. So no narcotics. It addresses the periodontal issues, not only mechanically, but also at the bacterial level, and annihilates all those aggressive anaerobes that are present down in the pockets. We do see bone regeneration without having to use additional grafting, and certainly the increased cost that patients have to endure. And we see more conservative traditional therapy, leaving options, like we said earlier, for retreatment. If you have to go in, then certainly you can explain to the patient that if you're potentially doing heroic laser therapy, that they might need more traditional approaches if your goal is to try to save that particular tooth. And the removal from any medications is not necessary. It's a fabulous way for our compromised medical patients. They do not have to get off any of their medications for you to be able to help save their teeth, and more importantly, get rid of their periodontal disease. So, there's without a doubt, it's a game changer in my practice, as I said. There's an incredible high patient acceptance rate. These are even patients who have been through previous periodontal therapy, and there's without a doubt they immediately accept my proposed treatment for laser therapy. And it's the best thing I've ever incorporated into my practice. I want to thank my distinguished colleagues for allowing me to present with them on the stage, and really my deep gratitude and appreciation to Dr. Alan Holland for his contributions to my presentation. Thank you.